from the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It is Thursday, April 28th. I'm Alexis Del Cid. Welcome to All Things Heart. Here's what we're talking about today. Breastfeeding Health Boost. We explore the new study from the American Heart Association linking breastfeeding to better heart health for the mom. But there are other important factors. We're talking with a cardiologist and lactation consultants about ways all moms can benefit, no matter how you feed your baby. Plus, we're taking you behind the mask. Our health team members are incredible inside and outside the hospital. The talents they're sharing with the community are pretty remarkable. And as always, if you have a question or a comment, you can share those on our Facebook, YouTube, or email us at allthingsheart@kumc.edu. We will be reading your comments and taking your questions throughout the show. So now let's talk about being a new parent. We've got car seats, cribs, diapers. You prepare for so many aspects when it comes to motherhood. But all that preparation, all the preparation in the world can't prevent the unique challenges that breastfeeding can present to so many new moms. Moms like Shannon.
On the day we catch up with Kansas City mom of two, Shannon Cochran, it's just her littlest baby Reese, and a big fluffy dog named Maggie. Bubbles! Reese's big sister Remy, always the social butterfly, is at preschool at a hat parade. Shannon's little family is clearly her source of all things joyful. But when she first became a mom, she says she was rattled at how difficult it was for her to breastfeed.
And it really lies on the mom to do it because nobody else can. So that was, I think the responsibility, but also just how much time it took was the most surprising and probably the hardest for me.
And she was so incredibly grateful her doctor referred her to the University of Kansas Health System's lactation clinic, where the lactation consultants and nurses helped her navigate everything from proper positioning, burping, even issues with engorgement. It made a world of difference for when she had baby number 2.
Having the experience and the history that I did with the first helped make this a really easy transition.
So when we tell Shannon about the study from the American Heart Association showing that women who breastfeed at some point in their lives are less likely to develop heart disease, have a stroke, or die from cardiovascular disease compared to women who do not breastfeed, she is happy, but she's also aware of how many other factors contribute to a new mom's heart health.
The resources, having great insurance, having a job that allows me to have insurance. I'm fortunate to get a 4-month paid maternity leave, which most women do not.
So Shannon has a message for the rest of the world when it comes to new moms.
Give new moms grace. If they're gonna be a little bit late for work, trust that they're still gonna do their job. It's hard. It's really hard to manage all of it, and if they're showing up and doing their job, that's enough.
We're so excited to welcome all of our guests this morning. We have cardiologist Dr. Shannon Hoos-Thompson, pediatric nurse practitioner and international board certified lactation consultant, Sallie Page-Goertz, and another nurse and international board certified lactation consultant, Morgan Jackson, who runs her own lactation practice called Prepared Beginnings. Hi, Morgan. And of course, our Kansas City mom, Shannon Cochran. Thank you all for being here. This is a great panel. First, I want to get to Morgan, because Morgan, you have two unique ties to the show in addition to being a lactation consultant. One, you got help from the experts here at the lactation clinic at the University of Kansas Health System for one of your babies. And there's a reason Sallie is giggling here. You were Sallie's patient when you were really little. That's how you guys first met?
Yes, yes. Nurse Sallie is what we called her. And she was our nurse practitioner for our entire childhood for myself and my siblings. So
Boy,
we love
circle.
Sallie.
Full circle. Oh, that's so sweet. Well, I want to acknowledge something that Shannon said. The very last thing you said in our story about you was about extending grace to all new moms. Why was that so important for you to express to everyone watching?
You know, I think it's hard for us to balance being a new mom, regardless of how many children you have and regardless of how you're feeding your baby, and managing your home, but then also trying to get back to work. It's tricky. And I think the more understanding people can be and the more grace you can give, the easier the transition will be. And, you know, it's just a phase. We come out of this, and I think too that more than likely you're going to be a better employee for whoever you're working for if you have an understanding of this phase of life, for sure.
Amen to that. I want to get right to Dr. Shannon Hoos-Thompson, our cardiologist, about this study from the American Heart Association. So the study says that women who breastfeed or have breastfed have a lower risk of heart disease and stroke. As a cardiologist, what do you make of this study?
So it's an association at best, okay? It's a survey. They took women from several different studies. The biggest one was around 300,000 women from China. So it's basically, they said women in middle-aged, hey, did you breastfeed? And if you did, how much did you breastfeed? And then, oh, by the way, at this point in life, had you had some sort of cardiovascular event like a heart attack, a stroke, troubles with heart failure, and then they just checked yes, no, and to the best of their knowledge.
Right.
And so it's not wonderful data. We take it, it's good data, but the bottom line is breastfeeding can be healthy for a woman, but is it going to determine her long-term heart health? The answer is no. And the last thing we want to do is take studies like this and then shame a woman or make a woman feel guilty or scared that because they did not choose to breastfeed or didn't even have the opportunity to breastfeed, that, oh my gosh, now I'm going to have a heart problem. The answer is no way. Know that breastfeeding is a choice, and no question it is safe for you and healthy for you, but there's so many dynamics that contribute to how that's going to work out for any individual that don't feel like you're setting yourself up for other problems just because you could or couldn't breastfeed. So really, from a heart standpoint, it's absolutely safe, but is it what's going to drive your heart health? No way.
That's going to be very welcome news to a lot of parents who are watching who maybe didn't get the chance to breastfeed or chose not to breastfeed. Sallie, one of your passions is also addressing health equity and the lack thereof and the lack of resources for so many women.
So I was thinking back to the study that we were looking at in the JAMA, that I went to look at the studies that they evaluated. So it was from Norway, from China, from Japan, from Europe, one smaller study from the United States with essentially no information in them about ethnicity, race, socioeconomic status, access to health insurance, all the things that we know can contribute to lack of access to health care, lack of access to great maternity policy for leave, lack of access to breastfeeding help when you face the typical challenges that come with those first days of feeding your baby. So all of that, I think, is a powerful message, and it's in the news every day right now, the lack of equity and access to health care for particularly minority populations, people of color. And that's why there are so many things that are important about things that are going on in our own community to help support, especially women of color. We've got Morgan's Practice. We have a group called Usazi Village that is reaching out to new moms, black moms in particular, in the Kansas City metro area to provide that support that women may have had some difficulty receiving.
I want to talk to Morgan. Morgan, you are so passionate about helping new moms. You started your own practice, as we've been talking about. How can we as a community, based on what you've seen in your practice, help new moms get these resources and the support that they need?
Yes, like Sallie said, it's in the news all of the time, the lack of access to care, lack of diversity in healthcare staff, which is a huge issue, and it can be a large barrier for a lot of women and a lot of families in general. And so understanding your resources is really important for moms. One of the big things that I am vocal about is searching out your resources during the prenatal phase or even before you become pregnant. So that way you are aware of the resources within your community. And if you aren't finding what you need, then you have time to maybe look outside of your circle. And that might mean virtual care or creating a team of your own that you're piecing together to have comprehensive care that meets your needs as a new mom. I think a lot of times we wait until after we have our baby to then start seeking out resources. And it's really hard when you're exhausted, you're sleep deprived, you're taking care of a new human. And then on top of that, you are seeking out resources for yourself and maybe even hitting some brick walls in the process. And so one of the biggest tips that I have is if you are a working mom, get in touch with your HR department and see what benefits your company might provide. There are a lot of companies that partner with virtual healthcare clinics that will provide you with free access to an international board certified lactation consultant for a prenatal visit at no cost because it's an added benefit from your employer. Those are small steps that moms can take in the prenatal phase that will set them up for success in the postpartum period. And they're not widely known and often aren't advertised, but if you get in touch with your HR department, that is a great way to find out what benefits your company might offer that you're not aware of.
One of the resources that Shannon has talked about, Shannon, when you needed help breastfeeding, you knew that there was a lactation support clinic here at the health system. How did you know about it? And what kinds of regular support did they give you?
When I had my oldest daughter, I knew that there was a lactation department at KU, but I wasn't aware of how to actually get there. And it was our pediatrician. He's phenomenal. And I was talking with Dr. Lewis and he was like, all right, let's get Jenny in here, who's the lactation consultant. And I think having the multidisciplinary approach in the clinic and having access to her right then and there was key. And then I, established a relationship with her and followed up with her weekly. And I think having her available, but she also called me to check in, which was really helpful because I was busy and exhausted, and just having someone call to check to make sure everything's going okay, I think really helped me get through, the first few weeks for sure.
There's so many moms who are watching right now who can't breastfeed, or they can, but they choose to bottle feed. Dr. Hoos-Thompson, I know for me as an adoptive parent, it was super stressful just knowing I couldn't breastfeed my son. I was worried, gosh, is this going to affect his health in the long term? Is this going to affect my health in the long term? So if you could go back 15 years, right, what would you have told me as a stressed out new mom who wasn't breastfeeding?
Take a deep breath and smile and just acknowledge it's tough. Again, you want a healthy baby, be a healthy mom. If you're not taking care of yourself, no way you're going to do a good job of taking care of that baby. And I think that's one of the things in our culture in a lot of ways, and there's going to be some of that, but you become a mom for whatever reason, and all of a sudden that's the priority, which is great, but guess what? If you're not taking care of yourself and other people aren't paying attention to what you need as well, it's not all on you, is the bottom line. And so the last thing you want to do is beat yourself up, or you find yourself getting closed in.
Right.
Reach out, okay? It's not all sunshine and rainbows. Motherhood and being a parent is a wonderful thing, but part of what makes it wonderful is the challenges, and a lot of those challenges you just can't control. So let go of control. You can't control all of it. Know that if you're taking care of yourself and seeking help when you need it, not just when the baby needs it, is what's going to set you both up for wonderful things and a better long-term life and relationship. So take care of yourself, and everything else will kind of fall in place.
It's definitely not what you see on everybody's Facebook posts, right? Everything looks so magical and so amazing, and it's not that. You start to feel that pressure.
Yeah.
Sallie, I also want to ask you about this. When it comes to the act of breastfeeding, there are also moms who are stressing that it didn't happen naturally. I mean, I have a really good friend who felt like she'd somehow failed because she couldn't figure out or couldn't get the latching, or I don't really know the right terminology because I didn't have to do it, but you've talked about how this is a skill that you practice with mom and baby.
So first I want to go back to one of the things that Shannon said about giving mothers grace. I also want mothers to give themselves grace. Having a new baby, everything is new. Your whole routines are different. Your relationships with all the people you have relationships are different when this new little creature comes to your house. If you've not been around babies, everything you're doing with this baby is new, whether it's putting the diaper on or putting the clothes on. I watch new moms trying to put a onesie on a baby, and you know, it's almost laughable that it's so hard to do, because it is hard to do when you've never done it before.
Right.
And breastfeeding is you know, one more thing that's new. If you've not been around other women who've nursed, you have no idea what it might be like to hold the baby. Is there a better way to do it or another? I've never watched anybody do this. The baby's never breastfed before. They certainly have some natural instincts, but sometimes we can get in the way of those depending on what the birthing experience was.
Right.
So I look at breastfeeding not exactly as natural, but as a skill that both the baby and the mother are learning together. And one should expect it to not be easy in the first several days and maybe the first several weeks. And the important thing is reaching out for help if it's not going well. And for some moms, we can help it tune it up so it's going better. Other breastfeeding couples, it just is not working. And the decision, what I would say to a mother who's having a difficult situation is the most important thing is that you like your baby. We know she's going to love her baby, but we want her to like her baby too.
Right.
And if this feeding mess is getting in the way of you liking your baby, we need to figure out something else.
Right. Oh, that's a good way to put it.
You know, the most important thing is the nurture part. And you can nurture your babies lots of ways. Breastfeeding is a wonderful way, but the snuggling part of breastfeeding is one of the most important aspects of that. My former colleague would say, you know, if we knew nothing about the benefits of breastfeeding for babies and for mothers, I hope moms do it because of the cuddling and just that feeling that it is of having your baby really close to you. And you can get that with breastfeeding, you can get that with any feeding.
Right. Or just attaching them to you, like I wore
wearing
my son
them,
around.
you know, wearing your babies. So there's lots of ways to get that close contact that's so important for babies. Security, for their brain development, talking to them, singing to them, not making them cry. Well, we don't make them cry. Not letting them cry and cry. Let me say that.
And these are things that all parents can do. Moms, dads, non-binary. Like these are just things you can do for the baby you're raising.
But I think a mother giving her own self grace is really hard. Mothers are really hard on themselves, and I feel like our social media milieu has made that even more difficult. People don't post usually their bad experiences. They post their perfect experience. They post their baby smiling. They don't post their baby screaming. They don't post their own selves crying. And I would say I've not met a new mother who's not had some crying episode at some point in those first 2 weeks, because we're a hormonal mess, and you know, we don't have time to take a shower, and it's just tough. Being a new mom there's no question, being a new family is difficult.
The showering always goes by the wayside. I remember moments where you're like, when did I shower last? I need to make that happen today. I want to check in with Morgan. Morgan, you faced your own challenges as a new mom that prompted you to get help from lactation experts here. What were some of the challenges? Are you comfortable sharing those so that other parents watching will feel like, hey, I have that problem, that challenge as well?
Yes, definitely. So after I had my second at the University of Kansas Health System, where I was working as a lactation consultant, we were having just difficulty establishing a really deep latch that was not painful. And all of the wonderful lactation consultants came to see me, a new baby, and everyone was checking in to make sure things were going the way that they should. And when it got to the point where I was so exhausted, I was at home crying, and I knew I needed another set of eyes, similar to what Shannon said when we went for a pediatric appointment. They said, do you want to see Jenny? We know that you're a lactation consultant, but do you want to see Jenny? And I said, of course. I'm having a hard time, and I'm too exhausted and too tired and emotionally drained to figure it out. And I think that knowing that you can see an expert that's going to be gentle and kind and thorough and sit and hold your hand through a hard time is really helpful. And I'm glad that I was able to sit down with a colleague of mine and we could discuss things and work it out. And just like Shannon said, have someone that was going to check in with me, because yes, I am a nurse and I am a lactation consultant, but I was also a new mom who was very tired and having health issues in the postpartum period. And I needed someone to come in and do what I do for other moms. And it was really nice to be on the receiving end of care that I so enjoy giving to other moms. And I think it speaks to the community of lactation consultants and how our primary goal is to support moms and families in the immediate postpartum period and anytime throughout the breastfeeding journey. Like Sallie said, like Dr. Shannon was saying, the goal is healthy babies and healthy moms, and that means caring for the whole person, not just the feeding experience. And one of the things that I've followed in Jenny's footsteps and other lactation consultants' footsteps in my care is checking in. It's sending a quick text. It's asking moms, how are you doing? What are some other resources you might be in need of? Who can I connect you with? Or just sending a motivational text of, you're doing a great job. And if you're having a hard day, it's okay. Hard days are going to come. Your baby's not expecting you to be perfect. They just want you to spend time with them and love them. But like Sallie said, there's so much pressure, and we don't give ourselves grace and extend that grace throughout the day and allow ourselves to maybe have a harder day as a mom.
Such good points. One of the things that Shannon, you've been talking about is that your employer played such a big role in helping you access all these different resources. And something that I think we've all discussed in this conversation leading up to the show is that there are a lot of employers that don't provide benefits that would help so many new parents. And Shannon talked about your employer had can you tell us about the service your employer had when it came to pumping and breast milk?
So yeah, as part of my job, I travel quite a bit, and a lot of times it means overnights. And my company provides milk store benefits, which basically is a company that will ship a cooler to my hotel and bags for the milk, and I just have to pack it up and take it back to FedEx, and it's at our door within about 12 to 24 hours for the baby to have. So there's really no lapse in time unless the FedEx package gets lost. But even, I had that happen and it still was at our house within 48 hours. So it's certainly an amazing benefit. And my HR department was very quick to say, hey, we have this service, incredibly supportive of our breastfeeding journey and making sure that my work didn't interfere with feeding the baby.
That's amazing. We're all like, wow, those are amazing benefits. I want to ask Dr. Hoos-Thompson and Sallie, first I'll start with you. What's the one thing you wish employers offered?
I think just acknowledging it. I mean, it's so important. Having a family and supporting families and individuals is awesome. So just them acknowledging that, hey, this is a big transition in your life. We value you as a person, we value you as an employee, and we're going to make this work for you because you matter to us. So I think that is a company or as a community is huge. So just the fact that it's not that's a specific, very awesome resource, but just anything, at least taking like even that HR resource individual saying, you're a mom, I'm a mom, I get it. Let's find a way to help you. Let's find a way to make this work for you. So I think just acknowledging it is the biggest step. And then the specific resources after that are great, but it bottom line is you can't do enough, but at least acknowledging it is a big part of it.
Sallie, what about you?
So most women have no extended paid maternity parental leave.
Right.
Many of my mothers in my clinic are going back to work 4 days after having a baby, 10 days after having a baby.
Oh my gosh.
So we think about breastfeeding, we think about just recovery from childbirth, which gets me to the importance of universal health insurance for our country. We are one of the only first world countries that has no universal health insurance for people. Looking at the benefits in a health insurance package and an employment package. A lot of the women I see are low income fast food workers, and even if they're working full time, they don't have any paid maternity leave. They don't have a good place to express milk if they're desiring to do that. They have the public bathroom.
Oh my gosh.
So I'll tell you, as a doctor, when I was a training doctor when I had my children, you have to find a ways to manipulate the system, otherwise you can't finish your training on time, which again, it denies you income. You don't have specific leave for that. So you set up certain rotations, so like OA, I use my research month, so I could take 6 weeks off, and then take a week off and the 2 rotations next week. So it's, it's not even built into the actual health system, let alone other things. So until we do a show that we're going to do a better job for the people in the healthcare system in world, it's hard to expect that from other companies. If it's like, we don't really even value that in the people who work under our own roofs and are doing all the work of healthcare.
So individually, we need to acknowledge this with the people we work with. To start
and ironically, I think one of the first places that needs to do a better job is training centers like here or anywhere that are academic centers. Like if we're going to be the standard, then set the example. And unfortunately, we don't do that very well at all.
We're getting a lot of community questions right now, so I want to get to those because this has been a hot button issue. We've been, ever since the promo for this show aired online, people have been writing comments. But first I want to get to Angela, who just wrote in, my hormones are all messed up since my cardiologist took my hormone therapy away. I'm miserable. Is there nothing for us women to help? You want to take that, Dr. Hoos-Thompson?
I would need a few more details. One, what are their risk profile? Kind of their ages, do they smoke, do they have diabetes, or they hypertension? So we've talked about that before, kind of piggies back to when I was here last time. And so the answer is, are you potentially able to go on? We want to manage your symptoms first, but we have to put that in perspective of your risk. So if you have other risk factors, especially smoking, diabetes, hypertension, 1, you should not be smoking, and 2, if your diabetes and hypertension are well controlled, then chances are you can get back on hormone therapy as long as you're having that discussion. So make sure your risk is identified, what it really is, or as best we can estimate, and then the potential for using hormone therapy or something, because obviously what we talked about before, we want your symptoms to be controlled first and foremost, but we have to recognize is there a risk when we do that.
This was an email I got. Jenny writes, I have a friend who's struggling with breastfeeding. What resources are available to her at the health system? So I'm going to take this to you, Sallie. Does she need to be a patient already to go to the lactation clinic?
No.
So does she just show up? What does she do?
She calls and says, I need an appointment with a lactation consultant, and our lactation consultants will figure out how to make that happen. We may ask her to make an appointment for her baby in the pediatric clinic, even though the baby, well, actually it's the baby's fault probably if she's having breastfeeding problems. So the appointment in our pediatric clinic would be through the baby, and the mother and the baby are seen as a couplet by our lactation consultant.
Kristen has a question for Morgan. Morgan wrote, was it hard to start your own practice? How long till you got off your feet?
Good question. So it definitely took time. It takes about 5 years to become an international board certified lactation consultant, depending on your background. I was already a nurse, so I chose pathway 1 to become certified. And then I worked in the hospital for experience. I worked in public health and then branched out on my own. So everyone's journey is different. What led me on, I would say maybe a faster track, was the fact that at the time, there were no independent private practice Black lactation consultants in Kansas City. And so I really wanted to expedite that journey so that moms that look like me could have a lactation consultant come to their home and serve them in a capacity that maybe they would not have access to.
How are you reaching out to those types of moms that you're describing? How do they find you?
I'm very active on social media. And so they can follow me on my Instagram page, which is Prepared Beginnings Lactation. I also am listed on the Greater Kansas City Lactation Association's directory. And so you can find all of the private practice lactation consultants that do in-home and virtual care. I'm listed there. I reach out to providers and have referral base. And then this summer I'll start doing in-person classes at a local yoga studio to
Wow,
reach prenatal
cool.
moms.
Question for Dr. Hoos-Thompson. Well, actually, it's not a question. I guess it's a statement that came in on our Facebook. This goes to what you were saying, Dr. Hoos-Thompson. This person writes, breastfed both my kids, didn't protect me from heart disease. Mine is genetic. And goes on to talk about quadruple bypass, all that. Which goes along with what you're saying is this study actually doesn't say the act of breastfeeding makes your heart healthier.
No.
Correct?
Correct. So it's safe. We feel comfortable saying that. Women who breastfeed have a tendency to lose that gestational weight a lot quicker. The potential for improvement in blood sugars and developing diabetes seems to be better.
Right.
It seems to be. There's an association. So there's an association, but that association is very loose. So it's not an absolute by any stretch.
The person went on to write, can the doctors talk about the injection for high cholesterol? I'm not familiar with that. Are you familiar with that?
You bet.
Okay. You're smiling.
So right now, hyperlipidemia, which by the way, do not check women's lipid profiles when they're pregnant that's a big no. Don't check lipid profiles during pregnancy or in the early postpartum window. By the way, it'll be not match anything that's considered normal. So just don't do it.
Okay.
Is a quick statement.
Okay.
But for lipid profiles in particular, for the most part, cholesterol medicines for women who have hypercholesterolemia and are higher risk for cardiovascular events during pregnancy, usually we can treat that to some degree, but you have to be a little bit careful. As far as injections, the injectable medicines are only for people with established coronary arteries, so they aren't used to prevent people at risk. But once, say, you've had a heart attack or a bypass or a stent, then it's time to consider something like that. And that's something, obviously, your cardiologist would address specifically with you, and it would probably be best addressed with a cardiologist.
Marcia has a question or a statement as well, and I believe I'll direct this one at Sallie. Some birthing people can't or have reasons for choosing not to breastfeed. Can you talk for a moment about parents that don't breastfeed, whatever the reason, who may feel shamed by others for not breastfeeding? What is your message?
That actually is a great question. And to me, the most important part about parenting is being close to your baby, however you feed your baby. And I think if someone is unkind enough to make a person feel bad, that's on that unkind person, right? And that the most important thing about parenting, whoever the parent happens to be, is snuggling that baby, loving that baby, talking, singing, reading to that baby, to have those very close, intense moments with the baby, which breastfeeding can be part of that, but it doesn't have, it is not all of that. Breastfeeding a baby is not the only way to have that very important, close, special relationship with a baby. And if people say mean things, they're maybe not your best friend.
Right. Amen to that. Dan has a question. Dan writes, I have terrible allergies. Is it because I was bottle fed? I heard you have less allergies if you're breastfed. Dan, I can say this to Dan. Dan, my mom breastfed me. I have the worst allergies on the planet. So it did not do anything for my allergies.
For your personal.
But is there anything to that theory that if you're breastfed, you have less allergies?
There are some studies that would say your risk of allergy is less or may happen later. And those studies are kind of mixed.
Okay. Exactly, yeah, there's no direct connection. So there's an association, but is it a direct connection? The answer is that's not very well proven from the evidence of medicine.
Okay. Yeah. Abby has a question. I'll ask Morgan about this one. Abby wants to know if there are physical benefits that do come from the act of breastfeeding.
Yes, there are multiple benefits for mom and for baby, but I'm going to focus maybe more on mom since Abby was asking. And the main benefit is having that connection with your baby. And like Sallie said, it doesn't have to be through breastfeeding alone, but when you're close to your baby, especially in the newborn phase and they're eyesight is not completely developed, they can see about 12 inches away. When you think about it, when a baby is suckling at their mom's breast, then they're about 12 inches away from her face. And so it's the perfect range for them to see their mom and pick up on facial expressions and hear their voice. You're gonna hear their mom's heartbeat and smell them. And so there's lots of benefits when it comes to your child's development, not just the benefit of breast milk alone. There's also the benefit for mom that she is going to protect herself somewhat against postpartum hemorrhage, because when you breastfeed, your uterus shrinks back down to its normal size a little bit faster than moms that don't. And so you have that added protection benefit. And there's also long-term studies that have showed there is some benefit to protecting against certain types of breast cancers and ovarian cancers. And so there's long-term health benefits for moms in that way as well. The weight loss, I say that's hit or miss, because most likely that's more genetics and very less likely to be tied to breastfeeding. It does burn a lot of calories, but I don't know about you all, but when I'm breastfeeding my kids, I'm always really hungry and I'm eating tons of snacks. So I don't think that the weight loss there is tied to breastfeeding.
That's good to hear the aspects, though, of how the benefits can also come from that closeness. And I remember holding my son and thinking, like, I can't breastfeed you, but I can look, I was looking at him and I would always be looking at his face and just trying to hold the bottle. I want to read some comments that are coming in, because I think if people want to be heard, and moms want to be heard, and parents want to be heard. So, and this echoes, thankfully, thank goodness that I have all my experts here who are echoing the same thing. Clementine wrote, all of my babies were premature and too little to latch on. So it was a cycle of trying and failing for an hour, pumping for an hour, feeding them bottle breast milk for an hour. They were so little, they had to eat every 3 to 4 hours. That left me an hour to try to sleep before the cycle started again. One was born under 5 pounds, lost weight because of it. I passed out from exhaustion, from trying to feed him. They had to take me to the ER for fluids. It was a disaster. This sounds like a disaster. And even after all that, some people still guilted me for giving him formula. Literally made me cry with guilt. I didn't even try with baby number 3. Clementine, that just kills me to hear that a mom went through that and then was shamed for that. It sounds like she was doing her best.
Yep. Yeah, it's back to, without a healthy mom, you can't have a healthy baby.
Exactly. And in working with women who are struggling with breastfeeding and things are seeming to get harder instead of easier, and they're like, and I'm like, the most important thing is the relationship between yourself and your baby.
Right.
And if all of this is making you not like your baby,
or not
we
like
need
yourself,
to do something
too.
different.
Yeah, if you're not liking
and if
yourself
you're not liking
because of the
yourself,
ordeal,
if you're not getting your own
good.
self taken care of.
It's not good.
So there is that balance, and for every woman, that moment comes at a different time.
Right.
Yeah.
Like,
I will tell you, just give you some background. So before I became an adult cardiologist, I did train in medicine and pediatrics. So I did my pediatric rotation, and yes, I'm a mom. But so I've been in the NICU, been in the pediatric intensive care in hospitals, and obviously
it's exhausting.
It's been a few years, but just to see that relationship or that that again.
I mean, the most
across
important
the spectrum
thing
of what you can be there.
is the relationship between the mother and her child.
Yeah.
And
or if it's a single dad, like that dad and the baby.
Like
my comment
exactly.
My comment to mothers has always been, if whatever we're doing here is getting in the way of you loving your baby, we need to get a different plan going.
Right.
Whether that's going to exclusive formula feeding, whether that's doing a mixed feeding, whatever it is that we need to do so you can enjoy your baby. Because the goal of all of this is that mothers and babies are happy and that babies are well fed. And sometimes that works with breastfeeding, sometimes it works with mixed feeding, sometimes it means that we're formula feeding, and finding what is the best thing for that mother-baby couple and that family.
I want to get to some final thoughts. This discussion has been so heartwarming to hear your perspectives, and from Morgan and from Shannon. Shannon, I want to start with you. You had the most amazing soundbite at the end of our story about you, about extending grace. What do you want our viewers to take away from this episode?
I think everybody's comments on giving grace to the mother was something I obviously didn't even have top of mind. And that's the most important part, to give yourself grace, give those new mothers in your life grace, whether it's an employee, your spouse, your sister, your neighbor. I think that's the biggest key from all of this. And the support, whether it's virtual, whether it's live. I think we certainly have a community of support here in Kansas City, for breastfeeding, for moms with pelvic floor PT and chiropractor. There's a whole team of people local to help, and it's just a matter of finding them.
Pelvic floor therapy is a whole other episode.
I won't be on that
women
one.
don't talk about. You won't be either. So someone's going to be on that. And not a lot of women talk about that openly either. Thank you, Shannon. I want to ask Sallie, what's your final thought?
That question is catching me a little bit off guard.
You have so many thoughts.
I have a lot of thoughts. The study was interesting. The population was a bit skewed. There's so much we don't know and understand about the impact of lactation, both on women and on babies. And that grace piece is really important. And Shannon brought that up. Give not for her own self, but I'm like, all of us need to give grace to each other when we're figuring out baby, mommy, feeding issues, and figuring out the best way for a mom and baby to be happy and for a baby to be well fed. And for many babies, that's going to be breastfeeding. For other babies, it's going to be a mix of feeding. And for other babies, it's going to be formula feeding. And the bottom line is a healthy mother, healthy baby.
And Morgan, your lactation consultant, your lactation clinic is Prepared Beginnings, right? You saw a need in the community and you went and filled that need. What would be your message to people watching who want to find you, want to access your services, and don't know that they have the resources to do it?
So one of the biggest barriers that I face is clients not understanding the benefits of working with the lactation consultant and how it really is not exclusive for breastfeeding only families, but if you're doing combo feeding, having trouble introducing a bottle, even looking to wean from breastfeeding, you can work with the lactation consultant. A lot of us in Kansas City do accept insurance and also have payment plans. So sometimes cost is a huge barrier for a lot of families, but knowing that there's flexibility in services, I think is a much needed access point for a lot of families, and not assuming that they cannot see a lactation consultant. There are free lactation clinics all throughout Kansas City that have like pop-up events like Uzazi Village. And there's also access virtually. And one of my biggest takeaways is, we know that about 75% of moms are working moms in some capacity. And if we can extend a word of kindness, if we can extend flexibility in schedules, we can get them in touch with resources that can make a world of difference, not just for that mom, but for her entire family. Because most of us are working moms, and normalizing the fact that, hey, this is hard. There's a lot to juggle. There's a lot on our plate. And yes, I can help someone with their breastfeeding needs, but they're also going to need someone that might help with pelvic floor therapy or mental health or balancing and understanding time management. And so knowing that it takes a village to come alongside of a mom, and that no mother is an island. And so no one should feel pressured to try and figure things out on their own. And there's no shame in asking for help.
I love that. And Dr. Hoos-Thompson, you're nodding your head yes and smiling, and this must feel good.
Yeah, so I think we've got the message. The bottom line is that heart disease is not driven by your decision to or to not breastfeed. And there are a lot more important things to focus on, and don't let this be a driver as far as what you decide to do.
That's honestly welcome words to so many moms. Well, one of the things that we absolutely love about doing this show here at the Medical News Network is getting to know our healthcare providers on a more personal level. We love taking you behind the mask. In fact, the last time Dr. Hoos-Thompson was on the show, she talked about her love of college sports. She played softball at Creighton. She started a scholarship for women who are playing college sports, which is amazing. Now we want to tell you about our nurse practitioner, Sallie Page-Goertz. In her free time, Sallie is a huge supporter of the Philmont Scout Ranch in New Mexico, which is so cool. And you're also, Sallie, medical director of Reach Out and Read Kansas City, providing new books to 40 medical clinics across the metro and encouraging caregivers to help promote literacy. Now, these are pictures with your little grandkids, right? Who are adorable. You have a QR code that we're going to put up if people would like to help reach out and read. What do you need most from people? What do you need most from people watching who want to get involved with Reach Out and Read?
So what we need most is money. We have sources to buy books at very low cost. So it's best for us to get money to buy those books through our resources. We do have folks who do used books drives for us. So we have gently used books in clinics throughout the KC metro area.
So cool.
For children coming for whatever they come to the pediatrician for. We use the money to buy new books to give to babies and children 0 to 5, along with literacy messages that are given through their healthcare provider during that visit about the importance of sharing conversation with children beginning essentially at birth. At that 3-day visit, we're giving out books to parents to read to their babies. So we leverage that money to buy lots and lots of great books for children.
It's great.
You know, Eagle Scouts and Girl Scouts, I forget their badge, they often do those projects for collecting books for us, which is so fun.
It's beautiful. So we put that QR code up. Also, this episode will live online forever, so you can scan the QR code, find ways to donate. And now I want to go to Morgan Jackson, because Morgan is just the cutest mama. She loves listening to audiobooks, getting outside in nature with her children. That's so good for the heart and for the health. And she loves baking. So Morgan, are you a bread gal or a cookie gal when it comes to baking?
Oh, definitely cookies.
Yeah.
Yeah.
I
love making. Last week I made banana walnut chocolate chunk cookies.
Yum.
They were so good.
We should have had you in studio.
Yes.
That was a mistake on my part. Do you have any favorite parks out here that you love to hit up with your kids?
Yeah, so we love the Blue River Greenway Trail in South Kansas City. And there's fun, like, little creeks to explore. And I love that at certain points of the trail, they identify different trees and vegetation so that you can learn about what you're seeing as you're enjoying the trail. So we love, I think that picture we were out on the little blue
nice.
River Trail. Yeah.
Well, if any of you love golfing, we have just the event for you. Anyone watching, if you like golfing, we have a tournament with heart. It's called Golfology for Cardiology, or Golfology for Cardiology. I should have said it differently. It's September 19th at Shadow Glen, the golf club in Olathe. So start practicing your swing. Register using this QR code on your screen. This tournament is so special because it raises money to help with cardiac services here at the University of Kansas Health System. So if you or someone you love comes here for cardiac care, this money directly helps you. And I talked with Vice President of Cardiac Services, Barbara MacArthur, who says the money raised through this tournament goes to all sorts of places, including helping with everything from rehab to a cardiac nurse navigator. And that's someone who will guide you every step of the way through your health journey. Nurse navigators are amazing. And speaking of amazing, we also want to celebrate Laboratory Professionals Week. Every day, nurses, physicians, and other healthcare workers rely on laboratory professionals to help provide a complete picture of patients' health. They are the heroes helping you behind the scenes with a direct impact on your care. We have 402 people working so hard at 10 different locations. Also, I want to give a shout out to phlebotomists. I love phlebotomists. They are so fun and quirky, and they always make me laugh when they're drawing my blood. So hats off to phlebotomists. I have a special place in my heart for you. So to all you laboratory professionals, we say thank you. And thank you so much for being with us today. Next week on All Things Heart.
For an 82-year-old, I guess I'm doing pretty good.
Doing well now, but what started as a simple blister on his foot nearly led to his whole leg being amputated. We're going to tell you about the heart connection to what went wrong and the surgeon who performed the first-time procedure here at the health system that saved his leg. That's next Thursday morning at 10 a.m. We'll see you then.